Today, we're looking at a seriously groundbreaking idea that's changing how we think about healthcare, especially for people in the most remote communities on the planet. I mean, we're literally talking about putting a hospital on wheels and powering it with AI. And that simple sentence, that's the entire philosophy right there. It's this powerful idea that just flips the traditional healthcare model completely on its head. The goal isn't just to build more clinics, it's to make healthcare mobile, to make it proactive. Okay, but that's the big question, isn't it? I mean, it sounds fantastic in theory, but pulling it off safely, affordably, and on a massive scale, that's where things get really complex. How do you bring top-notch medical care to a village that doesn't even have a doctor? Well, that's exactly what we're going to unpack right now. All right, so to really get why this whole idea is such a game changer, we first have to talk about the problem itself. And honestly, the scale of it is just huge. For millions of people, seeing a doctor isn't a small inconvenience. It's a massive, sometimes impossible hurdle. And just to put that into perspective for you, we're talking about a journey of 20, sometimes even 50 kilometers. That's over 30 miles. And not for some major surgery, but for a basic checkup, getting your blood pressure checked. It's not just the distance, it's the time it takes, the money it costs, and the pure physical effort involved. And this distance, it has a real human cost. I mean, think about it. A daily wage worker has to make an impossible choice, go to the doctor or put food on the table for their family. So things like high blood pressure or diabetes just go unchecked until, bam, it's a full-blown emergency. Plus, with no continuous medical history, every single visit is like starting from square one. It's a broken system, and it's tragic. So, how do you solve a problem that's all about distance? Well, you get rid of the distance. And that brings us right to the heart of this innovation, the hospital on wheels. Now, what's really important to understand here is that this health on wheels thing, it's so much more than just a van with the doctor inside. It's a whole ecosystem. You've got the van itself, sure, but you also have local health workers who the community already knows and trusts. And then you have this secret sauce, an AI-powered system that helps make smart decisions right there on the spot. Okay, so these are the 5 key pieces that make the whole thing tick. You've got the van, the health workers, the AI brain, a teleconsultation system to connect with doctors, and cloud-based health records. And the real magic is how they all work together. The van gets you there. The workers build trust, the AI crunches the numbers instantly, doctors are on standby for a video call, and the cloud remembers everything for next time. If you take away even one of those pieces, the whole system just doesn't work as well. All right, we've seen all the parts, but what does this actually look like for a patient? Let's walk through the journey. Imagine you're in a remote village and this van pulls up. What happens next? So the process is incredibly streamlined. First, you get registered with a simple ID. Then, a trained local health worker takes all your key vitals. We're talking blood pressure, blood sugar, oxygen levels. Right after that, the AI engine analyzes all that data in a split second and assesses your risk level. From there, you either get some advice, a video call with a doctor, or an emergency referral. And the best part? All that info is securely stored, building that medical history that just didn't exist before. Okay, let's zoom in on the AI, because this is really the heart of the system. And I want to be super clear. This is not about replacing doctors. Not at all. It's about giving the health workers on the ground a powerful tool, a sort of superpower that makes this whole thing possible on a large scale. The best way to think about it is like a traffic light for health. The AI looks at all the data it's given, your vitals, your symptoms, your age, all of it. And then it assigns a color. Green means, hey, you're doing good, just keep up the healthy habits. Yellow is a flag saying, let's get a doctor on a video call to take a closer look. And red means this is an emergency, and you need to get to a hospital. It's that simple, that intuitive, and that powerful. Again, just to be crystal clear, the AI is not making a final diagnosis. It's not saying you have X disease. What it is doing is flagging urgency. Its entire job is to look at a crowd of people and tell the medical staff, hey, you need to see this person right now. This is a massive time saver for doctors and makes sure that the people who are most at risk get help first. So, we've covered the problem, we've looked at the solution, and we've dived into the tech, but what does it all mean in the real world? What's the actual impact? Let's look at the big picture here. And success isn't just a vague feeling, you can actually measure it. You look at how many high-risk cases were caught early, you look at how much time doctors are saving because of the AI triage, and you look at the total number of people who are now getting screened who weren't before. These are the hard numbers that show, hey, this thing actually works. Any great idea is only as good as its ability to stick around and grow. And that's why the money part is so important. This model is smart because it doesn't just rely on one source of funding. It's a mix. You've got government programs, corporate funding, NGO partnerships, the whole shebang. This makes it way more resilient. If one source dries up, the whole thing doesn't just collapse. It's built to last. What's also really smart about this is how they've planned for the real world's messy problems. Worried about people not being tech savvy? They built a super simple interface and provide local training. What about bad internet? No problem, it has a full offline mode. Worried that people won't trust outsiders? They hire health workers from the local community. And data privacy? Everything's encrypted, and they always get patient consent. They've thought of basically every roadblock and built a solution for it. And really, this is what it's all about. This isn't just some cool tech project. It's a mission. It's about making healthcare fair for everyone. The ultimate vision here is a world where it doesn't matter where you live, how much money you have, or what infrastructure is around you, you can still get medical help. So the question isn't really if this model works, we can see that it does. The real question is, how fast can we get it to every single person who needs it?